Welcome back to Daily Connections. Once again, I'm here with Francesca Richardson, a psychotherapist who's talking with us today about depression. So Francesca, we were talking before the break, getting into the different types of depression and then into treatments. So let's revisit the treatments again. You said therapy and you said medication.
Right.
Can we go into more detail about that, what type of therapy? And
Sure.
I know you said no matter what, go for a little bit of therapy beforehand to see what the root of all of this is?
Yes, get an assessment.
Okay, an assessment.
An assessment, 1 or 2 sessions with a licensed professional to kind of build a plan of what, how to go, of what to do, whether it's a combination of therapy and medication or just one or the other. So generally, you know, with therapy, you'd want to go for, say, a few sessions,
okay,
and see if you like this therapist.
Yeah, that's key, isn't it?
Yes.
I think sometimes, you know, it's kind of like the hairdresser. I've gone to hairdressers before where I just feel awful, but something didn't click.
Right.
We're talking about a therapist. It's so much more important to really have that one-on-one personal connection with them and trust them.
Yes, they're working inside your head.
Yeah, they are, as opposed to on the outside. That's true. Is it okay to go to interview a therapist, and if you don't feel comfortable, to continue looking?
It is, definitely. I often talk with people 20 minutes on the phone first to just see if I'm able to provide what they might be interested in or what they need. And then also people will come to me for 1 or 2 sessions and we'll get a sense of, is this going to work? Do I have what they need? Do I have the training they need? And also, do they just feel comfortable with me? Do they feel like I get it?
Yes.
Because you do want to feel that the therapist in some way can understand where you're coming from, is empathic. And it's not a problem. People do go to 3 or 4 at times or more to really
until they find the right
click.
one.
Right.
Interesting. So where, in that first session with a therapist, what are they going to be looking for? What kind of questions would they be asking?
Well, they're going to want to have time to go over, well, they want to know that the therapist is asking good questions. I often say I don't have all the answers, but I ask great questions. So you want to see that the therapist is going in the direction to really understand with you, what are the symptoms? How is this affecting your life? What have you done for it before? What are the resources in your life?
You mean
resources
like
support
people, systems?
Job,
okay.
yes.
Okay.
How has the depression changed your functioning? How much is it bothering you? In other words, are you able to work? Some people just, can't work, for instance, or it's just
can't get out of bed.
Exactly. Or it's just making them irritable with their spouse. So it's important that the therapist is asking you, getting a whole kind of life picture, and that you're getting that you as the patient, as the client, are getting the feeling, yes, this therapist really gets it, is asking the right questions.
Sure.
It's getting to the bottom of it with me.
And then there are the medication as options as well, and sometimes that's used in conjunction with therapy, correct?
Yes, it is. Yeah, medication.
So many out there.
Right, yes, there are a lot of them out there, and that's good, actually. Although some people may need to try a few different ones before they find the right combination.
And why is that?
Well, because our bodies are so different, first of all. And diagnoses often cover such a broad range of symptoms. So, the doctor might be giving you a medication that works well with this diagnoses, with a person with this type of symptoms who's already taking these types of medications. On the other hand, it may cause some problems. It may cause some symptoms you don't like. So
side effects?
Exactly.
Okay.
And there's side effects at the beginning of medication. When you first start taking it, you might get sleepy or something. But then there's other side effects when you've taken medication longer. And so if you really don't like those side effects, then you want to think about, well, is this the medication for me? I'm not a psychiatrist, so I don't get into this quite as much. But since my patients do go on medication, I try to help them think this through. the medications do have side effects, and they are often, for some patients, they're hard to get off of. So that's why patients want to really get a good assessment.
An understanding of what's going on and what they're suffering from and what specifically their symptoms are, because then hopefully they'll be targeted towards the correct medication and, of course, under doctor's care, be supervised. And plus, then you're able, I would imagine, you begin taking the medication, you might get a side effect, you're able to keep clear in your mind what was an original symptom of the depression versus the new side effects that might be coming up and surfacing. So with the knowledge that there's treatment available, if I have a friend who I feel is suffering from depression, or I wonder, obviously, you know, unless you're a clinician, but I wonder if they're suffering from depression, what's a good way to approach them?
Well,
without scaring them off.
Yes, you might say, you know, I've noticed a change in you. You're not yourself, or I'm worried about you. Are you okay? You're not. You're a little more irritable than you used to be, depending on how close a friend you are. You know, there's just a change in you. I'm worried about you. Are you? And you might even ask, are you? Is there someone you're talking to, or you're able to talk to about this? Are you talking to a professional? Because sometimes people don't realize that there's been a change, and they'll come into me and say, I didn't realize that I'd changed until my friend said so.
Because it can be gradual, and I think it's so important for you to emphasize, because, you know, it's something that Francesca and I were talking about over the break, is that it doesn't have to be that you're manic depressed and you're having these extreme highs and lows. It doesn't have to be that you can't get out of bed in the morning. It can be subtle, but it can be pervasive in your life.
Exactly, yes.
And I mean, it comes on so gradually sometimes the person who's suffering doesn't even realize it.
Exactly, yes.
Wow.
Yeah. So they're not able to, you know, often we're not able to recognize what's happening to us. So it's wonderful if, as a friend or a relative, you could say to the person, you know, I think that there's something going on with you. Maybe you don't have to be this depressed or, you know, this irritable.
Yeah, this upset.
This upset, yeah.
Is it true that women get depressed more than men?
Well, it is actually.
Why?
Well, I actually looked this up. The NIH says has research showing that women get.
And the NIH National
Institutes of Health.
Of Health. Okay.
Yes, it shows that women get depressed twice as much as men. And the reasons have to do, they're not quite sure, but they're partially may have to do with the hormones, the changes in body chemistry, and may also have to do with social factors, such as women are often more abused also. So oppression, abuse, and then a tendency to not assert themselves. Women are socialized to be less assertive in general. So a lack of assertiveness can affect your mood.
And they find themselves swallowing it, but it festers inside.
Yes, yes.
And so many times when we talk about different things like this, it's about that festering inside. Different problems that can surface because that emotion's inside.
And depression, one of the ideas behind depression, one of the theories about it is that it is repressed anger. So that's why therapy can be so helpful, to help bring that out.
Interesting. Now, how about, does it come back? You know, once you've been treated for depression, do you have a higher, what am I trying to say?
Susceptibility,
Thank you,
yes.
yes.
Yeah. Yes, you can have a higher susceptibility to it. One of the things to consider is that for some people, they may need to stay on medication for a while, but also therapy can be really helpful to build strengths and skills for any time you face a future stressor. Plus, it can resolve old issues that cause the depression.
So that you reduce the chances that something's going to trigger an episode again.
Exactly, yes.
Excellent. Francesca, thanks so much for coming here,
You're
answering
welcome.
our questions about depression.
You're welcome. Thank you.